Mental health is a concept that people all over the world should know about. There are several definitions of this that is good to know about. There are also different disorders that someone can be diagnosed with as a result of having poor mental health. There are movements being made to improve these resources along with easier access to them. There are many parts of mental health that many people do not know about. There is an increase of those with poor mental health that need to know about the resources around them in order to get better and improve their well-being. Everyone has a different level of mental health. Some may not have issues with it, where others may have a hard time with maintaining a healthy amount of positivity. It is important to know what resources are out there in order to improve one's mental health, to have a better outlook on life. In this speech, I am here to inform you about the many different aspects of the concept of mental health and the growing importance of it. Today, I will tell you about the basic information behind mental health, the world realization that mental health is important, and the mental health professional shortage in the world. It is important to know about the overarching meaning of mental health so people know what they are looking into when researching different resources on the topic. There are different aspects of the definition of mental health. It is important to know the main aspects of it before going into the specific methods and resources being made for improving poor mental health. Mental health is important for everyday life. Maintaining positive mental health is good for an overall healthy lifestyle. Making certain lifestyle choices can affect one's mental health. If someone chooses to be around positive people who make them feel good about themselves, then they have good mental health. If someone falls into bad habits and influences which makes them feel bad about themselves, they may not have a good mental health and could possibly benefit from different resources. Mental health refers to one's emotional, psychological, and social well-being. Maintaining good mental health depends on these factors as well. Getting exercise, eating healthy, and being around positive people are just a few lifestyle choices that can maintain mental health. Unfortunately, a lot of people do not know about the resources in mental health. According to the article Mental Health by the Gale in Context online collection, less than 20% of children with mental disorders receive some sort of mental health treatment. If more people were informed by what is out there to treat those conditions, that statistic would be different. Having a poor mental health can negatively impact a person's life. If someone is not okay, mental disorders can become a result of poor mental health. Some mental disorders that can appear as a result of poor mental health are depression, schizophrenia, panic disorder, and bipolar disorder. There are several other conditions that can develop along with what I just mentioned. Another important mental disorder is post-traumatic stress disorder, known as a condition of persistent mental and emotional stress occurring as a result of an injury or trauma. This condition can affect someone's mental health and well-being, especially those who are in active combat and serve our country. This disorder is prevalent in that group of people. There are some controversies of mental health where some people do not agree on. According to the article An Introduction to Global Mental Health, one controversy that mental health professionals notice is which type of intervention produces the highest impact at the lowest cost. The two types that are mentioned are social versus biological interventions. This is a rising question in this field because costs add up for treating these conditions. Another controversy that is mentioned in the article is because many mental disorders start early in life and become chronic, should limited healthcare funding be spent on prevention or treatment. Unfortunately, everything comes down to how much something costs, and sacrifices have to be made in order to keep something functioning. The controversies that exist in the mental health field not only exist in the United States, but in other parts of the world as well. The world is coming to see that mental health is something that should be taken seriously. The world is beginning to come to the realization that mental health is important. The World Health Organization came to the realization that people's mental health is something to be taken seriously. They are making efforts in trying to provide resources for those who struggle with this concept. The plan from this organization is that it calls for several specific objectives and targets with a focus on improving global mental health governance and service coverage. The WHO's action plan consists of the principles of universal health coverage, human rights, evidence-based practice, life course, the integration of services, and patient empowerment. This plan addresses most, if not all, of the aspects of mental health and provides areas of improvement for those that struggle with it. Finding coverage for resources in this field is somewhat of a struggle because everything costs money. The reason why some people may not utilize these resources is because of their financial situation. Movements toward figuring out a way and changing that are being made. The United Nations also has a plan toward improving global mental health, which differs from the World Health Organization. According to the article, the UN's Sustainable Development Goals include only one goal specific to mental health, with a single indicator tracking suicide mortality rates. Unfortunately, suicide is a very negative result of having poor mental health. Many people cannot handle their lifestyle much longer, so they decide to end it themselves. The goal is to try and lower this rate and almost eliminate suicide as a result of poor mentality completely. The aspects of the UN's plan has good intentions, but others may side with the WHO's plan since it addresses more aspects of mental health. The goals of both groups are similar and have good intentions, which is the population that struggles with mental health. The WHO's action plan may seem more effective and influential since it displays more aspects of one's mentality. It is uplifting to see that multiple organizations are realizing that a worldwide effort needs to be made in order to improve global mental health. The goals of both organizations' plans are similar and could possibly inform the world that there are resources out there for those who need it. Problems may arise knowing that there are shortages of professionals in this field. There is a mental health professional shortage in the world. There are specific areas across the globe where there are not resources or people readily available to help those in need of those services. If more people worked in the field, then a shortage would not be a growing problem in the world. According to the article, an MHPSA is an area, population group, or facility that is experiencing a shortage of mental health professionals. Not having the personnel available for those who need it can be concerning and sometimes fatal. Suicide is the biggest and most negative result of someone having a mental health disorder. The goal is to have as little mental health professional shortage areas as possible. In some cases, financing is the reason why some practices cannot function and leave professionals without a job. Some may not be able to apply for loans in order to keep their practices open, resulting in these areas. Suicide is a fatal result of having a mental disorder or poor mental health in general. People give up on themselves and lose their will to live, so they decide to end it on their own. According to the article, limited access to mental health care services and underutilization are major factors in many places with high suicide rates. It is proven that with the proper resources provided for those with suicidal behavior and mental health issues, that the rates of suicide lower since they can make an effort to get better. There are several factors that go into where mental health access is easier to find. In the article, it is said that external factors such as lack of insurance, rural community, hours of operation, distance, access to services in languages other than English, and workforce availability have all been noted barriers to service. There are many factors, as stated earlier, that lessen the chances of getting access to mental health care. Since initiatives are being made, it is good to be hopeful that this problem will end and this type of care will be available to everyone. Mental health is something that should be taken seriously. It is important to know the different aspects of it to gain better knowledge of it. It is prevalent in all parts of the world. The only thing that is different is the access to care. Some parts of the world may have easy access to it, where others may have little to no access because of external factors. Large organizations are creating ways and initiatives to fix these problems and hopefully move to a position where mental health care is accessible for anyone who needs it. I hope you learned something from this speech on mental health and the impact it can have on a person.